While the Spanish flu and the coronavirus are among the largest pandemics the country has ever had to face, the threat of other deadly viruses has been a challenge for previous White House administrations, and that includes those who worked with President Obama. I spoke to former advisor Valerie Jarrett about what that was like and what they would have done if there was an outbreak in the White House during Jarrett's time there. H1N1, Zika, and Ebola, all dangerous viruses President Obama's administration found itself trying to control. According to the CDC, 12,469 Americans died due to H1N1, none due to Zika, and the two people who contracted Ebola in the U.S. both recovered.
It's an all-of-government approach here in the United States, but President Obama got on the phone and called our allies around the world and said, I need your help as well. If we're going to contain the Ebola in Africa and make sure that it doesn't enter any of our other countries, we're going to have to go to Africa and really work hard.
Valerie Jarrett, former senior advisor to President Obama, says her team left a guidebook and table exercises for the Trump administration in case of another deadly virus.
Those diseases gave us an opportunity to really challenge ourselves and our administration to prepare for just what we're going through right now. And so it's a stark contrast to what we've seen with the Trump administration.
More than 212,000 Americans have died from COVID-19, with more than 7.5 million infected. That includes the President of the United States, the First Lady, and dozens more connected to the White House. The ceremony to announce President Trump's nominee for the Supreme Court, now called a super spreader event.
We should not be surprised by any of this, and it's just devastating to think about people who are just trying to do their jobs.
Let's just say there had been an incident where someone contracted a disease like this within the confines of the White House. How might have you all handled this differently in terms of what we do now to keep everyone safe?
Well, first of all, we would have been following the advice of Anthony Fauci and Dr. Redfield from the very beginning. We would have been social distancing, washing our hands, and most importantly, wearing masks. We would have, if there was an outbreak, we would have done contact tracing to find out every person that person had in contact with, and then ask them to quarantine for the number of days that we were advised to do so.
And Jarrett did spend quite a bit of time in the White House. She served as the assistant to the president for public engagement and intergovernmental affairs from 2009 all the way to 2017.